Chicken cheese.
What?
Chicken cheese?
Sorry.
Oh. Oh. I don't know. People with dementia have experiences like this every day.
Hola, welcome to Case Stories by Dr. Josie, that's me, where you get to hear and learn stories from the hospital. One of the viewers requested I talk about Alzheimer's and dementia, and today that is what I'm going to be breaking down. I'm going to explain the disease cause, and I'm also going to talk about how to deal with patients with or persons with dementia. So what is dementia? Dementia is a loss of mental skills that usually affects the daily life, and it can cause problems with memory, thinking, and planning. And with dementia, usually it gets worse with time. So there are different causes of dementia, and we have like neurodegenerative conditions like Alzheimer's, Parkinson's disease, Down syndrome, and Alzheimer's disease causes 60 to 80% of all dementia. So dementia mostly is caused by Alzheimer's. We also have vascular conditions, that is diseases of the vessels, so that affect vessels in the brain. We also have infections like meningitis. We also have advanced age as a risk factor, head injury, stroke, tumors in the head. There are different causes and many causes that lead up to dementia, but the take-home message is that Alzheimer's causes most of the dementia presentation. So I'm going to talk about Alzheimer's today. So with Alzheimer's disease, as I've told you, it's a neurodegenerative disorder that affects the nerve cells of the brain. According to a 2018 research, it showed that it is the 6th leading cause of death. So with Alzheimer's, we can't say there is a specific cause or a specific known cause, but we have risk factors that predispose you to Alzheimer's. We have things like hypertension, that is high blood pressure, increased cholesterol levels, diseases like diabetes. It could also be genetics if there is a history in the family of persons with dementia. We also have smoking and alcohol use, and if someone has a mild cognitive impairment before, it could also predispose them to dementia later on in life. So what usually happens when we say that someone has Alzheimer's? What is this Alzheimer's and what does it do to the brain? So with Alzheimer's, it affects the neurons of the brains. And when we talk about the neurons, for them to exist, for them to function, they must do three things. So first, they must communicate. They usually have endings called dendrites that usually communicate together. Also, they must activate metabolism, and they must be able to repair themselves. Now with Alzheimer's, it dysfunctions these three things, and hence causing disruption of the neurons, hence disruption in the communication, disruption in the repair, and bringing about now the memory loss and the cognitive impairment. So how does Alzheimer's cause these cells not to communicate? So number one, I've told you there are endings that communicate together. So it can cause a plaque buildup. So if there's a buildup between the neurons, there won't be efficient communication, or the dendritic ends can tangle themselves together. When you tangle effectively, there will be no communication. So that is what Alzheimer's does to the brain. So in some autopsies, we know in autopsies we've seen that it is normal for you to have the tangles, and it is normal for you to have the plaque buildups, especially as you age. But with Alzheimer's, these plaque buildups and the entanglement forms very early in life and also at a faster rate. So the symptoms include memory loss, difficulty in communication, disorientation. They may have an impaired perception of time, unable to recognize familiar people, impaired executive function, They may get into depression. They may have psychotic symptoms like hallucination and delusions. They may also have behavioral disturbances, that is physical and verbal aggression. May also have hyperactivity and cooperativeness. Most patients have a problem of wandering. And repetitive mannerisms and activism. What this brings about, it can also lead to inability of them to care for themselves. That is basic things like cleaning, bathing, grooming, etc. The clinical manifestation, these symptoms, it is divided into either mild, moderate, severe, and end stage. So in mild, what does the person present with? In mild, they have memory loss. They have confusion about location of familiar places. They also take longer time to accomplish normal daily activities like handling money and paying bills. This is in the mild stage. Also, they may lose loss of spontaneity and sense of initiative. This is someone who used to wake up and go to their job. Maybe they have a shop, they open it up early, but now they lose that spontaneity and you find them now lagging and you're wondering what's the problem. It could be an indication of mild symptoms or a mild stage of dementia. We also have a moderate. Now in the moderate, we are progressing. In the moderate, we have now increased memory loss, there's increased confusion and shortened attention spans. We also have problems recognizing friends, family members, difficulty in language, problems with reading, writing, working, and especially dealing with numbers. They also have inability to learn new things, and they are restless, they are agitated, they usually present with anxiety, they have a loss of impulse control, and they have perceptual motor problems. So this is things like they have trouble getting out of the chair. This is the moderate stage of the presentation. In severe, the patient now can't recognize almost all family members, and they also can't communicate effectively, and now they completely depend on others for care. So here we're talking about grooming, eating, just simple tasks. They completely depend on someone in the severe stage. For them, all, like when you look at that person, all sense of self seems to vanish. Other symptoms include weight loss, seizures, skin infections, increased sleeping or lack of sleep. So this is in the severe stage. In the end stage, this is where the patient is majorly in the bed, cannot converse, cannot recognize anyone. In the end stage, there's not much you can do, and here the patient is totally dependent. As we said, they are majorly in bed all day. Even though Alzheimer's disease and dementia is not curable, we still manage it, and the goals of management is to maintain the patient's brain function as far as possible. Remember, we have the stages. To treat the patient's psychiatric and behavior presentations, also to decelerate the likelihood of progression into complications, to focus on emotional and supportive care of the person, also to reduce the morbidity and mortality as far as possible, and to improve the quality of life. So in the next episode, I'm going to break down how we deal with a patient with dementia care. This will be basically mostly nursing things, but in management, there is the medical part, and the medical, will be treated according, the person will be treated according to how they present. And now we have other things like the non-medical, like aromatherapy and massage. We have music therapy. We have blue light therapy. We have also counseling. We also have cognitive stimulation therapy and life story and reminiscence work. These are the non-medical management form of dementia. Check out next episode for the management of the patient. Ciao.